interview here to bring you, and this is
Bill Reynolds.
Bill Reynolds. Bill, good morning to you.
Hi, good morning.
Yeah, nice to see you.
Important topic because, and not to compare the two, but we talk a lot about our pets getting scared because of the fireworks.
Correct.
A lot of people don't realize that people themselves can have PTSD. Doesn't necessarily mean that they're veterans or associated with the military, but the sights and the sounds of what we think is a fantastic celebration can be very frightening for many people.
Absolutely. Yeah, a lot of veterans struggle with that. One of the hallmarks of PTSD is something we call hypervigilance, and you can also have what's like an easy startle reflex. So I've known veterans that have intentionally left town where they're having large fireworks celebrations in order just to not be exposed to them, because it can certainly trigger difficult memories from combat or any kind of military service they have.
How do you treat that when, at the behavioral health center where you work?
So I work at the Meadows, and what we do is we have a program there called Unbroken, and it's specifically for veterans and first responders. But we also have programs for that treats PTSD also for non-veterans, and it's a combination of things. There's specific types of therapies, such as cognitive processing therapy. There's something called acceptance and commitment therapy. We do something called EMDR, which is eye movement desensitization reprocessing. But a big part also of trauma treatment is just feeling safe, right?
Yeah.
Being in a low stimulus environment, being comfortable with your surroundings, and having skilled trauma therapists.
What are the triggers and what are the signs and symptoms
Of PTSD?
Yeah.
Yeah, so everybody has different triggers. A lot of people, again, another hallmark of PTSD is something called intrusive thoughts. So these are thoughts that somebody can be walking and just, having a good day, and a loud noise, for example, is a great
like a firecracker?
Yeah, like a firecracker, and that can bring them back to Iraq or Afghanistan or any kind of combat situation that they're in. So hyperarousal is a term that we use also for PTSD, and those are people that are just constantly on edge and highly, highly anxious.
Take us through, if you can, and help us to understand what is going on when inside someone, when they're dealing with that. It has to be very difficult.
It is. There's a sense of a lot of veterans feel that other people can't understand certainly where they're coming from, and many of us can't.
Yeah.
But everybody has different levels of PTS. Some have relatively mild symptoms, but some people have more severe. And I treated a Vietnam veteran several years ago that was basically living in constant flashbacks. A flashback, sometimes I think that term is misused, but a flashback is actually reliving the experience. On this one veteran I had, he thought he was in Vietnam a lot of the time. So it took a lot of therapy with him. We had to dial in his medications appropriately until he can get to a much safer place.
For people who are at home watching, perhaps they have military experience, maybe they're just recently back, or anything else, any other trauma, how do they know what they're experiencing is actually PTSD? Like, do you get a physical symptom? Is it a thought? Is it both? What can, and I know they're probably individual, they're different to each individual, but is it like an anxiety? Is it, are you sweating physically?
A lot of people do experience that. A lot of people have panic symptoms, but PTSD used to be classified as an anxiety disorder. It's not anymore. It's in a sort of a different category, but people frequently describe to me that heaviness in their chest, that just feeling of alienation and distance from other people, like they can't, really relate in real time to people. And again, nightmares, right? A lot of veterans struggle with very, very poor sleep.
Yeah.
And depression as well. We know that depression and PTSD are often linked like this.
And no sleep can just exacerbate the issue.
That ruins, everything if you're not getting sleep.
This is kind of a side topic on that, but is there, does health insurance cover all of this? Because sometimes I feel like they don't always cover these types of things. But in this case, do they now?
I think, it depends upon the insurance, right? There's many different types of insurance out there. Like at the Meadows, we take Blue Cross Blue Shield, which is widely accepted. But most insurance companies should cover mental health care. And I know that the VA also is a big resource for our veterans.
Is there a fix to the PTSD? Can you be cured of it, or is this something most people live with forever, but they learn how to live with it?
You hit the nail on the head. Most people learn to manage their symptoms. Over time, certainly the severity of the symptoms can decrease, but the goal is, there's no magic cure per se. There's no magic pill out there. I mean, we use medication sometimes to help with the depression and the anxiety, but yeah, learning to live with it and manage the symptoms is really the goal.
I did a story, it was a couple of years ago, it was on medicinal mushrooms. And right now I think the state has allocated some funds to initiate kind of like a study, a pilot program of some sort to work on that. Your thoughts on that? I actually did interview a couple of different veterans who said that it helped them with those type of issues. What are your thoughts on some of the research, if you've read through some of it?
I know, so there is a lot of positive research around what we call the psychedelics, and there's something called ibogaine.
Yeah.
There's a popular movie out now on one of the streaming channels that showcased veterans doing that. I guess my personal thing is that for people that struggle with addiction and then giving them something that's potentially addictive is kind of like, I'm not sure.
Yeah.
And I've seen mixed results. I know some people have had phenomenal results with, remarkable reduction in symptoms, but I've known a couple of my patients that went down to Mexico and had one of those treatments and they actually got worse.
Oh,
So
wow.
I think it's not a magic bullet. It's still being studied. I know the VA is doing some really exciting studies right now.
Different treatments, different medications work for different people.
Absolutely.
That's just pretty much how it is.
Yeah.
Okay. How do people find you?
People, the Meadows. So the Meadows has been around for 50 years, if you didn't know that. Our main campus is up in Wickenburg. It's a beautiful treatment facility. Used to be a dude ranch back in the day. You can go to the website, the Meadows, and we also have an outpatient center here in Scottsdale and also around the country.
Love it.
Thank you.
True Western location,
Yes,
right?
it's a beautiful campus.
It's a gorgeous up in that part of Arizona.
I used to drive from here to Las Vegas all the time, so I know where you're at.
You know Wickenburg, man.
Yes,
Yeah.
I know
gorgeous.
Wickenburg. Yeah.
Thank you so much
Thank you.
for coming
Happy
in.
4th of July. Be safe.
We appreciate it.